from 35 billion shillings in 2022 to 59 billion shillings last year. Because the prices of milk has moved from an average of 35 shillings to now an average of 50 shillings a litre. The reform in that sector is putting more money, the agricultural sector that is putting more money in the pockets of farmers, whether it is in coffee, whether it is in tea, whether it is in sugarcane, whether it's in dairy. And we are looking at the future on how we can better pay our dairy farmers. We are now rolling out a whole industry around leather so that more farmers can have earnings. So we have a program for the future on what we need to do to enhance the progress that have already been achieved in the agricultural sector. The third item that we have discussed in this retreat is a reform that we committed to the people of Kenya of the education sector. We have undertaken far-reaching, transformational reforms in the education sector. What was the situation that confronted us? We had a chronic teacher shortage problem that was known to everybody. We had some measure of misunderstanding on the competence-based curriculum. And we had crippling debts facing our universities and institutions of higher learning. Many of you know that many universities were paying half salary to their lecturers. Migosi here will tell you that many universities had debts in the region of all our universities had debts in the region of 120 billion shillings. Many of them could hardly pay as you earn. They could not pay NSSF dues. They could not pay all the dues that were government. They could not pay their suppliers. And in fact, 23 universities were technically bankrupt. That was the situation we had. And it was beginning to affect the quality of our education, because without teachers, with confusion, with debt, and not enough resources provided to teach our children, naturally, education was beginning to suffer. And so we took up that challenge as was presented to us by the people of Kenya, and we made commitments. We made a commitment that we were going to hire 116,000 teachers to close the gap of teaching. So far, by January next year, we will have hired 100,000. Already 76,000 have been hired. And we are focused on making sure that the majority of these teachers go to schools that today have fewer teachers. You may want to know this, that we have an education system that is very unequal. We have schools that have 2-3 teachers. We have schools that don't have a laboratory. We have schools that there are no adequate classrooms. And so it was necessary for us to intervene. So we've hired more teachers. We've built 23,000 new classrooms, 16,000 by the national government, 7,000 with our partners under CDF. We have streamlined the competence-based curriculum, working with the stakeholders. We went out to listen to Kenyans on how they wanted this to be, and we have now completed, and now it is no longer competence-based curriculum, it is now competence-based education and training. We have since changed the funding model. Rather than focusing on the university, we are now focusing on the student. So now we have a student-centered funding model that makes sure that every child in Kenya is treated fairly. And those who come from backgrounds that cannot support their education, they get affirmative action. And that is why we have students from poor families today under the new funding model who will get up to 90% government scholarship, so that no child in Kenya is left behind. Of course, like any new funding model, we had challenges. Some of the students were placed in the wrong banks, many other issues, but we have reformed that sector. And the new funding model is now going into its third year. So we have because of the new funding model, we now have adequate resources going to our universities. Ask any vice chancellor. The old funding model almost destroyed our universities. Today, our universities are on sound footing. I had an occasion to go to Cooperative University. I asked the Vice Chancellor directly. He gave me a report that he could now pay his staff, lecturers and staff on time, in full. He could now pay his suppliers. He could pay government taxes. And he just asked me to continuously look at making sure that the means testing instrument was accurate, so that we place students in the right bands. What do we intend to do going into the future on education? Number one, we still have schools that have no laboratories. And some of our students engage with the Bunsen burner for the first time during exams. So we're going to build 1,600 new laboratories, especially in rural schools and schools that do not have a laboratory today. Waziri, when is that exercise beginning? July. That is next, in the next few weeks. Number two, as I said, we're going to hire another 24,000 teachers. The money is in the budget this year. By January, they will be in class. And next year, we will hire the balance of the teachers so that we get to the 116,000 that we committed ourselves to the people of Kenya. And then we will also not just close the gaps on infrastructure or teacher numbers. We will also streamline and enrich the means testing instrument so that we make sure that every child is placed in the right band so that we don't disadvantage any child in Kenya. And then we will engage with the stakeholders going into the future to test the efficacy of the programs that we have worked on. Let me go to the fourth item that informed. I told you I'm going to talk about 7 items. The fourth item that we have discussed this morning is matters to do with health. The people of Kenya told us, and we recorded faithfully, that health was destroying families. 1 million Kenyans every year sunk into poverty, statistics show, because of health-related costs. Many citizens sold their properties, their livestock, they used their savings for matters health. And progressively, health was becoming a privilege for those who can afford, leaving behind those who could not, to the vagaries and to the designs of fate. So, we looked at the situation and we made a commitment. And we all know that every person has in their phone WhatsApp groups formed to look for money to pay for hospital bills for a brother here, a relative there, a friend in another place, a stranger in another place. Members of parliament, leaders, MCAs, and everybody else in between can testify to this. So, what did we do? Before I talked about what did we do, the situation was that, we're doing Harambes left, right, and center. NHIF had accumulated a debt of 32 billion shillings, owing so many facilities, and that debt was growing by 1 billion shillings every year. So it wasn't getting better, it was getting worse. And it was just a matter of time before NHIF would finally collapse. So we decided that this universal health coverage that successive administrations have been trying to implement, it was there you all remember, in the NAC manifesto. It was there subsequently in the NASA manifesto. It was there in our Jubilee manifesto. It was there in the Azimio manifesto. We had it in the Kenya Kwanza manifesto. And we all agreed that it was something that needed to be done. And somebody needed to do it. And some administration needed to actualize it. After many failed attempts, we looked at it candidly and we said, we must provide a very firm foundation, a solid legal foundation, because it was a very heavy responsibility. So we had stakeholder engagements before the elections, we had stakeholder engagements after the election, and we finally came to the conclusion that it was not possible to reform the NHIF because it was fatally broken. And we decided that we needed to have a new health framework. So over the last 2 years and a bit, we passed 4 pieces of legislation to underpin our universal health coverage for the people of Kenya. We repealed the NHIF Act. We have rolled out primary healthcare fund, social healthcare insurance fund, the chronic illness, the chronic and critical illness fund, and the whole SHA program that now underwrites our health requirements. What does this new framework present? How is this new framework? What are the characteristics of the new framework? Number one, we have democratized and brought equity and burden sharing in the contributions towards health. In the past, it was just contributions by the people who have pay slips and jobs. Now we have made it possible for all Kenyans to contribute. We have also made it equitable. In the past, poor people contributed 10%, minimum 500 shillings to social insurance. Those of us with better earnings, we contributed 0.something%. So the difference between 10% and 0.something% isn't right, and it wasn't equitable. So we decided that it was time to give equity. So everybody for social insurance now pays 2.75%. So we have brought it down for the vulnerable, the mama mbogas, the borders who are paying 10%. Now they are paying a quarter of what they were paying, 2.75%, and provided equity for all of us. Number 3, we have removed the manual system and digitized health from admission, through treatment, through surgery, all the way to discharge is now on a digital platform. Because the manual system was a recipe and a heaven for crooks and criminals to steal from the fund. In fact, a big failure of the NHIF was largely contributed by fraud and corruption. We all know of the history on the incidences. We found out that under NHIF, it was possible to amputate one person 10 times. And that begs the question, how many legs did this person have? Under the new arrangement, if you carry out 2 amputations, the system will not accept a third one because it will show that you have 2 legs, both of them have been cut, so you have nowhere else to. It was also true, as we all know, that there were small hospitals, like the one we had somewhere in Kino, that were carrying out more surgeries than what was happening in Kenyatta. yet they were on some third